there, Gladys. I'm happy that your sugar is better controlled.
Gladys Terry didn't even know she had diabetes until she came here to Good Samaritan's Free Health Center of Price Hill last May.
I haven't had no health care since 2009.
Gladys is like the other patients who come here. She makes too much to qualify for programs such as Medicaid, but not enough to afford insurance, even though she's worked all her life.
And since 1976, I worked at Recto Molded Products up to 1992. I was on the assembly line. It was a plastic molding production, and even though I loved the job, it was low wages and stuff like that. But then I worked at Hardee's from 1992 to 1999 as a cook up there, and I was always dedicated to every job that I've had, and I've always done perfect attendance.
The center is run like a doctor's office with appointments and electronic medical records. The doctors and nurses all volunteer to be here.
They are extremely grateful, and that's the part where you say, oh my gosh, I didn't do that much. None of us has a lot of time to spare, but for me this is as rewarding as anything else I do.
Overall, these people are so wonderful. I'm sorry I get teary-eyed, but they are my angel.
More than 1,000 patient appointments have been made at the center since it opened last January. A diverse group of people who share one thing in common: they can't afford health insurance.
We have a woman who is a chemist who lost her job because of downsizing, and she's gone through all of her unemployment and all of her savings, and now works part-time at a Panera because she can't find a job, but yet she needs health care. So people are smart enough to know that you shouldn't be using an emergency room as your primary care doctor, but they don't have an option. And so what we offer is an option.
Type 2 diabetes is where that keyhole is all gummed up and that key doesn't fit that well. And one of the things I learned is what gums up that keyhole is fat.
The center addresses the whole person. The group medical appointments teach patients about healthy living, how to grocery shop, cook, and eat in a different way.
The yellow pepper, yellow bell pepper, carrots, red bell pepper, and then has anyone heard of jicama?
I have never cooked beans, and knowing that you can cook beans in different ways and make it taste different to eat it, I learned that, and we learned how to make these different salads with the hummus and all that stuff. We didn't even think about it, and then now we can make it and eat it. It's healthier.
There are so many patients who come here who haven't seen a doctor for maybe decades, and so this is an opportunity to empower them.
Slow, deep breaths through your mouth.
I think that this is a terrific place to be able to do the kinds of things that make you feel good about medicine.
You walking today. I want you healthy.
It's a real sense of community. I think the group visits that have been established for our diabetic patient population really are very reflective of that sense of community and the whole sense of well-being for the whole person that have developed. The components in that we've developed, we've had nutritionists that have come in. There's even a small walking group that's kind of spilled out of this group just from the patients themselves as they realize they have to develop a more healthier lifestyle.
Go back again. Oh, now there's uphill. Oh yeah. Oh yeah. Look at you, girl. Give me some. Give me some fives. I love it. Good job.
John Pemenides is a personal trainer who gives his personal time to help patients understand how exercise fits into their new healthy lifestyle.
We are establishing a medical home for these patients.
Okay, perfect. Well, just to see if she's here. Excuse me.
The medical home is small, very small. It is the first floor of the Santa Maria Community Center. Volunteers work with donated equipment and just 2 exam rooms. Limited funds and staff had the center open Wednesdays and Saturdays. Funding from private donations secured by the Good Samaritan Foundation will keep the center open another year and allow for expanded hours. There is also talk of renovating the space to accommodate more exam rooms and add dental services.
What we all sometimes tend to forget is there's a certain amount of luck with what we all have. You know, we're lucky that we're born into the families that we're born in, that we've had the advantages that we've had. And some folks aren't so lucky.
Okay. You sound very clear today. I get a lot more out of it than I put into it. I think we all feel that way. I do look forward to it, but I'm especially happy after the visit. There's always a surprise. There's always something that I didn't encounter or I didn't anticipate. Really feeling like I made a connection with a patient, really feeling like maybe I made a difference.
Your boots are heavy, your pants are tight, your butt is swinging from left to right. Down, 1, 2, down, 3, 4.
And the people that I seen coming here, they leave out smiling with new knowledge and new understanding about the illness.
I come in, I start to sign the paper, you know, when you come in. And she said, "Oh, Bud, you don't have to sign that." And the doctor gave me a hug. A hug! You're not judged. You're not judged. And I think that's one of the most door-opening gifts that they give you.
For the first time, I felt like somebody cared about me. Cared about me.